The World Health Organization could be about to decide if 2 Chinese vaccines should be approved for emergency use. Independent experts have been assessing shots from Sinopharm and Sinovac. Sinovac is confident, saying its vaccine is effective against variants that have been found in South Africa and the United Kingdom.
目前已有的这种流行的情况来说，我们产生这种给人体注射后产生的抗体还是有效的。我们呢是针对这些可能流行的这种现在变异的这些毒株呢，也在开展新的以它为毒种的这些疫苗的前期的一种研发工作。
A WHO emergency listing is a crucial international endorsement. It's a signal to national regulators about a product's safety and efficacy, and it can then be included in COVAX. That's the global vaccine sharing program. However, some WHO experts have expressed caution, saying there's not enough trial data.
Now, for a closer look, we're joined by Dr. Bharat Pankhania from the College of Medicine and Health at the University of Exeter. Thanks for joining us. Do you think Sinovac and Sinopharm's vaccines will get WHO approval?
I think so. My shortest affirmation is yes, they will. So provided the data is independently scrutinized and looked at for efficacy, it is a good vaccine, easy to make, easy to deploy, easy to use. And even if the efficacy is lower than the ones that we're used to with Pfizer, Moderna, AstraZeneca, this vaccine will save lives, and therefore I see it being deployed.
Dr. Pankhania, as you've mentioned, both of those vaccines do have a much lower efficacy rate than the others that we've seen approved. What then are the implications for those who receive these vaccines?
Well, it will save their lives, because even if the efficacy is lower than the Pfizer, Moderna, AstraZeneca ones, it still protects lives. And our game is to reduce infections globally. And if you can deploy vaccines in amongst a situation of severe shortages in the poorer countries, then it is a good thing. Remember, the influenza vaccine, the seasonal influenza vaccine, also has a low efficacy, around 60%, 70%, no more than that. But we still use it every year. Therefore, with the Sinovac, Sinopharm vaccines that are seeking licensing from the WHO, they still do their job, even if they might not be in the high 80s and 90s.
And how much would approval then for use boost global supplies in vaccination efforts?
It'll make a difference, and it is an additional armamentum in the race to immunize as many people as possible, as fast as possible. The big issue is that unless and until we start immunizing in the poorer nations, highly populated countries, we won't get on top of this, and we'll keep on generating variants of concern and interest. Therefore, it is good to make and good to deploy and immunize as fast as possible all over the world.
So given the concerns that have been raised by some experts, Dr. Pankhania, and the fact that some feel that there could be more trial data, particularly with the elderly, many might hesitate to take up these China vaccines, even if they are approved. What are your thoughts on that?
I can see this, but in a situation where, look at the cases in India, and if I were to be offered in the middle of that here is a vaccine that may save your life, then anything is better than nothing. And my sincere advice to people all over the world would be, if you are offered a approved vaccine by independent authorities like the World Health Organization, please take it. It may save your life.
And the EU's regulator is also reviewing Sinovac's data for possible approval. Would the WHO's decision influence that process, do you think?
No, I would hope not, because I would hope and I expect that the evaluations are independently conducted by independent authorities. If there is one approves and therefore another approves, that makes a nonsense of the approval process. Therefore, I would want the EU, the countries' regulatory bodies and the World Health Organization to all remain independent and exclusive of each other. Therefore, one is not influencing the other.
Dr. Pankhania, thank you very much for your thoughts on this issue. Dr. Bharat Pankhania there from the College of Medicine and Health at the University of Exeter.